Annabelle Rabia's morning walk to harvest crops looks much different than most farmers.
Just looking at how everything's going.
And yet there Annabelle stands, surrounded by lettuce.
The earlier you harvest tomatoes, the better.
And tomatoes.
We're still growing colder, hardy crops.
Very much a farmer in their own right.
Since it's such a small space, we do a lot of really tight interplanting.
This might look like your typical urban garden, but it is located on the roof of a hospital. This produce is bound for patients who need it.
You know, like if we grow spinach, we'll talk to patients, say, we just grew that outside your window. They love that.
A few years ago, David Maffio started thinking about food. He oversees support services for Boston Medical Center, where this garden is based.
Last month, we served 5,700 people.
Most of these look great, though.
As the idea took root, it grew into something much larger than anyone planned.
You know, we want to build a food-resilient infrastructure in the community we serve.
We're in the hospital. Yes.
In the basement of the hospital, there is a food pantry.
We screen patients for food insecurity at the primary care clinics,
where Lachman Hurlel is filling prescriptions for patients. Not for antibiotics or ointments, but for fresh vegetables grown right on the roof.
We want to provide healthy food and appropriate food to these families.
And Olivia Weinstein
We are in the teaching kitchen.
brings even more to the program. She runs a teaching kitchen inside the hospital.
So it's one thing to recommend dietary changes, it's another to teach dietary changes.
Her goal is to help patients use that fresh grown produce as part of their treatment plans from their doctors. And right within view is a live look at that rooftop garden.
We've had a lot of hospitals across the country either call or visit this farm.
Where David Maffio is very proudly talking about how the program recently gained national attention from the White House Food Summit.
I think for others across the country, there's a lot of hospitals like ours that could learn from this, and I think we'd love to help them replicate that.
The new succession of collard greens.
A prescription for fresher, local produce filled right above the ER. In Boston, Massachusetts, I'm Chris Conti.
Thank you for joining us this week for our look at health in America. Next week, we're talking about crime. We'll give you an inside look at the high-tech equipment stores are installing to stop the problem. Until then, from Denver, Colorado, I'm Chris Stewart, and this is The Race.